Hi, I'm Dr. Scott Beavers. I'm a licensed chiropractor and I'm a diplomate of the American Chiropractic Board of Sports Physicians. I want to take a second and talk to you today about concussion. What is a concussion? What are the most common signs and symptoms? And what are the most important things we can do if we suspect we've had a concussion? Now, concussion also is called a mild traumatic brain injury, an MTBI, and it can also be called a sports-related concussion. Concussions are really injuries to the brain. The most common ways that we suffer injuries to the brain include a jolt or jar that affects the brain or the body, and these can come from sports-related injuries, car accidents, hitting our head, bumps, jolts, and jars. Now, the most common symptoms associated with a concussion include headache, dizziness, blurred vision, buzzing and ringing in the ears, difficulty going to sleep, difficulty sleeping. We can also experience trouble thinking. This is what we call cognition. So this is difficulty learning, difficulty remembering, difficulty with our short-term memory. Now, if we've suffered an injury that we think has resulted in a concussion, the most important step that you can take is to get to a qualified healthcare provider and be evaluated. In fact, recent research shows that the most important factor in recovering from a concussion is the length of time between injury and the time the patient gets to a qualified healthcare provider. We know today that there are several techniques and technologies that can be employed early in the course of a concussion that helps reduce symptoms, can speed recovery, can help athletes get back into the game sooner, and avoid what we call post-concussion syndrome. Now, if you or a loved one has suffered what you think might be a concussion, I would highly recommend that you reach out to us, and you can reach us at our office, and we'd love to meet you and discuss the first steps to getting you back onto the road to health.